ABVI, which stands for the Association for the Blind and Visually Impaired, is one of the mission programs under the Goodwill of the Finger Lakes. What we do here is help people who have a vision issue that is no longer correctable by glasses or contacts or medications or surgeries. We are a part of their continuum of care, and we help them functionally with their day-to-day goals and what may become difficult because of their vision loss. So the low vision exam entails evaluating their functional vision as well as objective measurements of their clarity, their acuity, any blind spots they may have. We also observe how they interact, how their mobility is, how they're getting into the exam room. Any dexterity issues will help us make decisions on what kind of devices we'll prescribe for these people. In addition to the low vision exam, we have vision rehabilitation therapists, and they really help with the day-to-day functioning. So sometimes they'll deploy out to the person's home and help with really just day-to-day activities. Another section is orientation and mobility specialists. They also work one-on-one with the individual for safer independent travel. So sometimes that involves learning long cane techniques, sometimes it's just awareness of steps and curbs. They will take it out into the community if somebody needs to ride the bus to get to work, even just crossing a road safely. For a patient's kind of social and emotional health dealing with their vision loss, we have a lot of programs here through our social work department that help them grieve and accept and succeed with their vision loss. Lastly, we have a technology department. So there's a lot of adaptive technology that is made specifically for people who have vision issues. And there's a ton of mainstream technology that we can teach them how to use to overcome some of their vision issues. It's a myriad of issues day to day, depending on where the vision loss is, if it's central, peripheral. But central vision, if you can imagine, anything you want to look at is going to be somehow distorted. Macular degeneration is a condition that affects the macula. The macula is the area of your best central vision in your retina. That central vision becomes distorted, whether it's wavy, blurry, there could be spots missing. So if you're looking at somebody in the face, you may not be able to tell their face, but you can see their outfit, their legs, the rest of their body. Reading becomes difficult because this blind spot is right in the center of what you want to try to do. So cataracts is a normal aging change. It's just the lens inside your eye, which is typically clear growing up, it begins to yellow with age. So you get this overall kind of hazing, blurriness to the vision. It's a very gradual process, but your acuity, the clarity of your vision will decline a little bit. You can get some interaction with lights. You can get starbursts around lights, up close, far away. So reading, seeing faces, seeing road signs, and overall blur. Glaucoma, it's where the pressure inside your eye builds up, and then the high pressure affects your optic nerve. The optic nerve is what connects your eyeball to your brain. It sends the signals back to the brain to provide vision. When the pressure increases in your eye, it compromises that optic nerve and it affects your vision. In glaucoma, the vision will start to deteriorate out to the sides, and before a patient realizes that, they've already lost so much. Once you lose it, it's gone. You can't get it back. But low vision rehab can help you manage with what you've got left. Diabetes can affect the small blood vessels in the back of the eye. And the blood vessels can bleed, they can leak fluid, so you can get swelling in the back of the eye. The vision issues can vary. Again, you can have blurry vision, you can have splotchy vision, like patches missing, things can be distorted. It can kind of look cobwebby and floatery. So there's a variety of diabetic issues that can happen with the eye, the retinopathy being the most common. I left private practice to come to do low vision because I just felt like there was more for me to do, more for me to give. I think this is a very underserved population. I think what we do here is a critical component of their care, and I feel that for the most part, patients are so appreciative of just the knowledge that we can share with them to make their lives an ounce easier. It's very fulfilling work.